who is a consultant eye surgeon and the medical director of True Vision Eye Hospital. Firstly, thank you so much, sir, for accepting this and coming onto our podium. Sir is specialized in cornea, cataract, LASIK, trauma, medical retina, and glaucoma, and experience over 12 years and who's performed more than 15,000 eye surgeries. I think that speaks about the experience sir has. Trained at premium institutes across the country. He's done his MBBS from Vydehi Medical College from Bangalore, and then he's finished his MS from Chalmada Anandrao in Karimnagar. He's done his fellowship in cornea, cataract, and LASIK and anterior segment from the renowned Aravind Eye Hospital. Presented various papers in the national and international journals of ophthalmology. Worked as a medical director and chief surgeon, now heading his own eye hospital, True Vision Eye Clinics and Opticals at Khajaguda. So I think it's an honor, sir. I think to have you on this show, and thank you so much for accepting this and coming on to help our audiences understand a lot about these eye surgeries. Thank you.
Thank you for the very kind introduction, Dr. Virenchi. I'm very happy to be here on Healthy Dose at WurkTV on a beautiful, grim, I would say, Sunday. But yeah, it's a Sunday. I hope everybody's all snuggled in and ready to get their healthy dose on eye care.
Absolutely, absolutely, sir. So, Dr. Garu, when it comes to eye surgeries, there is, a lot of misinformation that people get. And unfortunately, these are the days where people are accessing Google for everything. And this is one of the major reasons to bust those myths and make medicine and science more clear. We have started this talking about your field. What is the whole cornea phaco mean? What is all of this about?
So while in my practice, at least personally, I do encourage my patients to Google their symptoms or any diagnosis or any kind of information they want to. But I would also say that take it with a pinch of salt because Google, as a search engine, it goes from the mildest to the most extreme complications or side effects that can occur with any disease or even with any medication. So I think they should just take it, like some generalized information from it, not delve very deep into it. For that, you always have your doctors to do that for you. And coming to the second part where you're saying, you're asking me about the cornea and everything. So my specialty is about cornea, cataract, LASIK. In this, what happens is when you're saying cornea, that is the outermost part of the eye, which is this black part you're seeing. It's actually not black. It's just like a transparent watch glass, what you have. This is the cornea of the eye. So when we talk about LASIK, wherein youngsters who prefer to not wear glasses, who want to get treated for it and get rid of their glasses, the procedure called LASIK is performed on this layer, this cornea, wherein in layman's terms, I would say the laser is fired in exactly an algorithm wherein it totally removes the refractive power of the eye. So that's where the cornea comes into picture. And when you say phaco, phaco is actually an abbreviation of the whole word is phaco-emulsification, wherein this is totally unrelated to the cornea. This phaco-emulsification is performed in cataract surgeries. So what we do is with a very high ultrasound power, there is a probe which we send it into the eye, and this basically melts away your cataract. It melts it there and then, and also has the ability to aspirate it. So it takes a very small keyhole incision, about 2.8 to 3.2 millimeters. That's all it takes. But this incision is performed on the cornea, and from there the probe goes inside towards the lens and melts it away. After that, we implant the intraocular lens, the artificial lens. So phaco is phaco emulsification done for cataract surgeries.
Right, right. I think that's a very beautiful explanation that you have given, Dr. Garu. Uh, it's scary, but when it comes to eye is a very small organ, and uh, while you're saying all of that, we understand how delicate it is. But I think experts like you are making it easy for a lot of people. But what category of people come down for these surgeries, like the cataract and the lasik surgeries? So who is this for?
So you hit the nail on the head, Dr. Virinchi, when you talked about the importance of eyes. There is a saying in Telugu, Sarvendriyanam Nayanam Pradhanam. That means that of all the five senses you have, the sense of sight or vision is the most important, because if you don't have eyesight, there is no world around you. So yeah, having said that, nowadays the blind schools and all, are the way they're helping the blind people or visually disabled people to cope up with their day-to-day lives is really commendable. So when it comes to the eye, especially when you're asking me about what kind of patients or categorized for these surgeries. When you talk about LASIK, it is basically any young patients above the age of 18, or to be on the safer side, we would say 6 months. If your power is constant between two readings after the age of 18, you are eligible to undergo LASIK. This is to remove your glass power, and we don't usually prefer or recommend LASIK for patients who are above the age of 40. Even if the patient insists on it, we give them the rider that anytime after 40 you might get your reading glasses, your presbyopic correction. So presbyopia is something we still haven't been able to cover or correct with LASIK. The research is still ongoing. Few promising results, but till it comes out into the market, I think it will take some more time, some more FDA, some more research has to be done on that. So LASIK is primarily to correct your distant vision. So post 40, we don't usually recommend. There are other options for that. But yeah, 18 to 40 is the age group which usually falls into the LASIK category. For cataract, yeah, ideally or primarily we see that in old age groups, probably above 55, then it can go up to 80 also. Whenever at whichever stage that patient presents to us, then we would, going by the vision, how it is affected, and how much cataract density is there, going by that, we recommend the surgery. But one thing nowadays, what has happened because of phaco-emulsification, cataract surgery is revolutionized. It has almost become a daycare procedure, wherein your surgery takes about 10 to 15 minutes, and hardly any bleeding or any discomfort to the patient after that. Patient takes rest for a couple of hours in the hospital, and then he's good to go. So that is one thing about cataract, which has become quite a easy, ordeal for the patient. On top of that, if you compare the procedure wise, previously we used to, as doctors, eye doctors would say, he let it mature, let the cataract mature, and then we'll go in for surgery. But now it is totally the opposite. We are not letting it mature because of the usage of phacoemulsification. We are going in for a cataract surgery as early as 55 also. Because what is happening is, if the cataract is in a mild state or moderate stage, I would say somewhere around 50 to 60%, it is a perfect time to operate, because we don't want the cataract to be mature. The more mature it becomes, the more harder the nucleus becomes, and that more laser we have to fire to burn this or melt this nucleus away, which is not a good thing for the eyes. Previously, they used to ask us to wait till it matures because the incision used to be huge, and the whole idea was to remove the nucleus as a in toto piece. So they used to ask the patients to wait till it matures. But now, when it has become a keyhole surgery where you're trying to melt it away, it's obviously better or recommended when you get it done at an earlier stage rather than wait till it gets matured. So yeah, anybody after 55 eligible for a cataract surgery, and 18 to 40 is where you would recommend a LASIK surgery.
Well, Dr. Garu, now, like you said, cataract is, after 55. Uh, is there a possibility where we see cataract even in younger population?
Of course, cataract usually it is seen in the older age group, but we have cataracts, different types of cataracts. You have congenital cataract, wherein the baby, for any reason, be it congenital conditions or some medication which the mother had taken during the pregnancy and everything, baby is born with opacification of the lens, which is basically cataract. Then going further ahead, there are cases where you have cataract in the age group of 20s to 30s also. Again, due to some maybe long-standing medication for some systemic disorder, patient would have taken uncontrolled diabetes. All these cause cataract at an earlier stage. Also. Most common we have seen is in cases like rheumatoid arthritis, wherein patient is put on a high dose of steroids and for a longer duration. This can induce cataract. It can induce glaucoma. Even something as simple as skin ointment, uh, which your dermatologist would prefer, and which has a mild dose of steroid, and you use it for a long period of time. This itself also has a chance to uh, cause cataract in early young patients.
Now, since you said, there is a good possibility that somebody can develop cataract even at a younger age, what are the warning signs that an individual should look for? When does an individual, when should they be visiting the eye specialist?
That's a very nice query. So yeah, one of the most common symptoms the patient presents with in cataract would be diminution of vision. So basically, the patient is complaining that he or she is not able to see properly. Vision is affected in some way. How sharp they used to see things, far away things before, it's not happening now. Another thing they can come up with is when they see this bright lights, they you see a halo around it, or that shimmering effect, the glare, what you would say. All these are also symptoms. Or when oncoming headlights from another vehicle, they're causing this glare and everything excessive than which is normal. These are all indications of cataract. And yeah, when patient comes with these kind of symptoms, and then we go in for an examination and see changes on the lens, that's when we come up with the diagnosis of cataract.
Right, right. I think this is a very useful information, sir, because a lot of us believe that a cataract is only something that comes in the older age group. But yes, like you said, with changing lifestyles, with a lot of these health-related issues spurting up early into our lives, I think it's good to always keep these warning signs in our head and consult an eye specialist. And I think, like you said, it's always good to do it at an early age instead of waiting it for a longer time. Sir, when we talk about eye surgeries, people are worried. Like you said, it's one of the most important sense organs. It's about beauty. So people always want the latest technologies, and a lot of times people say that it's better I visit a foreign country where the technology is more developed. Where do you place our country, in regards to all these newer technologies?
Oh, right on top. No doubt about that. In fact, I would tell you, Dr. Virinchi, because of our sheer population size, we are the most sought after for any international companies for their research. So whenever they come up with a new machine, they usually give it to the premier institutes. Here we have the eye hospital. One of them is where I did my fellowship from Aravind Eye Hospital. We have huge, demand when in these companies they come up with the newest technology and they want us to give it a try here because there's a lot of volume based practice here. So they want our numbers, our research. They want to do their research here. They want us to try this machines and everything. So that way, research side we are totally covered. There's a lot happening in terms of research in India, in all the premier institutes. And another thing is even the machinery which we have is definitely on par with any country you would take. Uh, Majorly, Germany is one place which always has come up with innovative technology in terms of eye health and the machinery. Yeah, so whatever you have there is what we are also using here, be it in terms of the machines, the investigation, the scanning equipment, or even the lens, all the latest. We do have it here.
Well, I think this is great news because people always think about traveling to a different country for a better service, but you've given us that hope that we have the best of the technologies here in India itself. Uh,
In fact, if I just may pitch in one,
Please, please.
uh, even if you look at the expenses or part of it, we even though we are giving the healthcare on par with all the other countries, it is much more affordable here than in the foreign countries.
Right, right. Well, Dr. Garu, when it comes to any surgery, I think the first thing that usually a layman has in mind is a fear or a worry. And in regards to any condition, when there is a surgery suggested, I think the first thing that the patients ask are, is there anything else other than the surgery? So can we skip the surgery? But yes, we do understand that surgery is a great treatment. But what people are more worried about is the safety in regards to these surgeries. So can you please let our audiences know how safe these surgeries are in different age groups?
So, uh, the, if you talk about, if you try to categorize it and start off with the younger age group, again, we talk about LASIK here. So, LASIK is a procedure wherein the laser is fired on top of your cornea to remove the your refractive power so that you don't need to wear glasses. So, that's the basic principle. In LASIK, what happens is it is a very safe and bloodless surgery, uh, mainly because the laser involves only the cornea part of your eye. So once the laser is fired, there is no any chance of any bleeding or anything, and there it's done. But the thing about LASIK is that you as your doctor, the doctor has to be sure of which patient goes into which procedure. That is the most important thing, categorization and giving you the right advice, because what procedure you go in for depends on your power, on the scan, which gives you measurements of your cornea and other structures of the eye. These are the most important parameters which the doctor has to consider and give you the best idea. When it comes to the procedure, it's a fairly simple procedure wherein you just fire the laser. but it is most crucial that your doctor is very sure about the correct procedure and the safe procedure for you. And on top of it, the newest lasers which we are using have come up with a lot of advancements, because previously we would see some chance of regression, wherein regression means if you have a very high power and you go in for LASIK, there is a chance that after a couple of years, a little bit of this point, let's say you are a -9 and you've gone in for LASIK, probably after a few years, zero point 0.5 or 1 would come back. But this was regression, and this has been something which also has been addressed now in the newer machines, wherein the chance of regression is very less. So, and the correction is excellent. The amount of laser also which we fire now to remove the high powers has also become very less. So that way, LASIK has become a very safe thing. And then when you come to talk about cataract also, yes, because of phaco-ML, it is a bloodless surgery. It is a painless surgery, become a daily care procedure where 10-15 minutes and you're done. But in the end of the day, it is still very much a surgery wherein we are going inside the eye and operating. So yeah, it comes with its own set of complications, albeit the occurrence is very low, but still it is a surgery. Patient should take all the precautions which the doctor has advised and use medication at the right time.
Right, right. Well, Dr. Satyagaru, would you like to, talk about some myths in, regards to these surgeries? Because you've been in this field for more than a decade. I'm sure you meet so many people who come up with some new myth, and a lot of us could be having those myths probably. Would you like to tell us a few about?
There are surprisingly there's still so many. Like one of now I would term this as a myth now, because the whole thought has become redundant. The whole thing, like when I said previously, ki, don't wait till the cataract matures. That is an old saying now. We don't abide by it. We would like to operate earlier, so that the chances of complications and the chance of better or faster recovery is there in cataract surgeries. Another thing, another myth they would say is ki you're not supposed to eat some kind of particular foods after your cataract surgery, like dal or fish or whatever, patients say, which are try to avoid it during surgery or after your post-op period. So yeah, all those don't really matter nowadays. The chances of infections and all are very low because it's a bloodless surgery. So, and another myth patient comes up with is that till 1 month after the surgery, you're not supposed to take a head bath or face wash. That is also not true now. I personally allow my patients to take their head bath and face wash 3 days after surgery, which is they are very comfortable about. And when you talk about LASIK, one of the myths is ki at one point of power, patient thinks ki, I'm not eligible for it. But the thing about refractive procedures now is there are so many options. So there is an answer for every kind of problem or power patient has. Yeah, these are some of the myths in terms of eye care.
Well, when it comes to a surgery, like I said, there are these fears always, and eye is a very delicate organ, so people are worried when they want to approach for a procedure. So, how important do you think it is to go with a trusted eye hospital, or with a trusted doctor?
Obviously, it is very, very important to go with a very good institute, a very good eye doctor who is recommended, or nowadays, if you're seeing Everything is on social media. People are become very aware, which is a good thing. So they are going into the reviews and everything about the doctor, and then going and approaching, which is good. They should see in the end, at least as far as I deal with my patients, I feel ki, in a span of maybe half an hour with me in the hospital, they have entrusted me with their eyes. So that is very important for me. So I take my relation with the patient after the surgery also. It is not that once the surgery is done, it's all over. Anytime I am very much approachable over phone, or in the hospital with for all my patients in their post-op period. So like that, yeah, you should go for a trusted institute, a trusted doctor who knows what he is doing, who knows what he is advising, and even in terms of equipment, has all the latest equipment, has a good sterile OT. These are all the things you should look into before you go, because eye surgery is like a permanent thing, be it any kind of surgery you take, retina, glaucoma, cataract, cornea, any trauma also. These are all, they kind of impact your vision in the long term. And most of these surgeries are a one-time thing. If you take about cataract, it's going to be permanent. Once you implant the lens, and that's something, it's going to be there throughout your life. So always do your research, take the recommendations of people around you, and only when you feel comfortable and you trust the doctor, go in for it.
Dr. Garu, can you share a bit about the culture and details at True Vision? What kind of patients have you been seeing? Have there been any celebrities that you've met that you've helped them with their vision?
So yeah, I have been in this practice for almost 12 years, Dr. Virinchi. I have worked with premium or premier eye hospitals in the city. So now I have come up with my own eye hospital, which is True Vision at Khajaguda Main Road. Uh, Talking about the culture in TrueVision, I've been very particular to say that this is, yeah, so even if you walk into my clinic, there's a big shloka at the reception which says Vasudhaiva Kutumbakam, which is something I want to tell all my patients who walk in, that feel comfortable here. Whatever service we are providing, it's going to be the right one. It is going to be optimized for your eyes only. It is going to be customized for you, and basically it is like everybody's welcome here. And I want to create that whole concept wherein previously a doctor and patient relationship used to be one of trust and honesty. So I want to get back to that. Probably in all these years, there has been some kind of friction now in that equation. But yeah, I basically am coming from a family of doctors. Me being the fourth generation, so my
Wow.
father, my grandfather, whatever they have taught me is what I used to see them when I used to see them practice. So the patient used to, tell them about everything. That much. That's the amount of trust and connect they had with them. That is something I want to get back to now. So we are not like any investor-driven entity wherein a patient is just a set of numbers at the end of the day. No, we don't want to do that. We will never do that. It is all about the patient, their trust. They should feel comfortable with us. Yeah, that is what I'm trying to bring in with True Vision. And if you're talking about celebs, yes, I have had my share of 15 minutes of fame. Primarily, I would say I have been very lucky to meet and treat the legend himself, Sri Amitabh Bachchan Garu, when he had a little eye concerns. Then, she Manju Bhargavi garu, who's a Kuchipudi exponent, had the privilege of treating her too. There are others also. There are people who have walked in and trusted me with their eyes. Have been very happy to have helped them. Yes.
I think this is great news, Andy. మీరు చెప్పిన తర్వాత I think one. I think sometime back you were saying the first 30 minutes with you, and it's actually been 30 minutes, and I'm very excited to actually meet you. And at the same time, I'm sure our audiences want to have a quick sneak peek into the whole new setup that you've done, the new clinic. So I think we should play a small video and have a look at the clinic before we go into the next questions. Audiences, we have a video coming up, so please watch it. And any questions that you want with Dr. Satya Garu, please put it in the chat, and we can ask sir and know more about whatever doubts you all have. So let's go with the video, Andy.
So I hope everyone's seen the clinic. It's come up on Khajaguda Main Road. It is True Vision Eye Clinic. It's on the second floor, right above Juice Salon on the Khajaguda Nanakaramrugoda Main Road. As you can see, we have all the latest equipment which is necessary to treat any kind of eye conditions. And some of the things, like I said, when you asked about the culture of True Vision, is main thing is transparency and honesty in all the diagnosis and the required treatments. One of the things I have been doing is that we're trying to explain to the patient what the condition is, what it is, what is the best treatment that is recommended, and how to go about it. Also, even throughout their post-op period, also I am very much. It's like I believe that hand holding is required by the doctor because the patient has undergone surgery with you. So yeah, always there to help our patients.
But a very beautiful clinic, Andy. I
Thank
think it clearly shows that you made it with a lot of passion.
Yes, yes.
And it's beautiful.
Thank you.
I'm so happy. I'm
You
so
should
happy
come
to see
visit us.
that. Absolutely, Andy. Talking to you, and the clinic is an eye candy. So I think for more beautiful eyes, we should come there.
Yeah, please.
Dr. Garu, now since you asked me to come down, and I'm actually planning to also, what are the prerequisites? I mean, for these surgeries. I mean, when do we go ahead, and what all do we need to check before we plan these surgeries?
Before any kind of eye surgery, there is a set of preoperative tests which we would recommend for all the patients. basic blood work, as in your CBP, your complete blood picture, blood sugar levels, most important. If possible, HbA1c also, to know your whole past 3 months sugar control. Then an ECG is also recommended. HIV, HBS, AG, these are also a part of the preoperative checklist. Yeah, these are more than enough. In case a patient has any cardiac conditions and the doctor feels it is required, we usually ask for a cardiologist fitness certificate. But since most of the surgeries are topical, if the doctor feels the patient can handle the surgery or go through it, then yeah, we can go ahead for the surgery. But these are the basically the few tests which we would recommend.
Dr. Garu, you see, you spoke about diabetes, and diabetes is one condition, uh, one condition where we're commonly seeing. So a lot of people believe that when they have diabetes, it is not right to go for a surgery. So, what are the precautions that we take when we are trying to treat a diabetic patient, and how comfortable is it to plan a surgery in a diabetic patient?
The irony of it, Dr. Virinchi, is that it's the diabetic patients who come up with or who necessitate any kind of surgery at an earlier stage than other people, than the normal non-diabetic population. So, having said that, yes, you need to keep your sugar levels under check, not only for your eye health but general health also. But we have seen people with diabetes usually end up with a faster progression of cataract. They come in earlier for cataract surgery than others. So when they do, we try to check their HbA1c the last 3 months, how good their sugar control has been. And just before going in for surgery, we would do a random blood sugar. And if these are a bit on the higher side, we generally postpone the surgery.
Yeah.
And another aspect of diabetes is, or mainly what diabetes affects in the eyes, more than the cataract, is the retina. So there is a entity called diabetic retinopathy, wherein there are a set of changes in your retina which occur with uncontrolled sugar levels. These could be proliferative diabetic retinopathy, wherein you see swelling in the retina, you see blood clots, you see new vessels forming, and even after this, if patient hasn't been good with his sugar control, it kind of goes into more severe complications in the retina, as in retinal detachment also, which is one of an emergency in the eyes, which mandates an early, surgery at the earliest. So this is the havoc that diabetes causes in the eye, especially when it comes to the retina. So try to keep your sugars always under control. Even one episode wherein it goes above 350, be it for whatever reason, some stress, or you have not been taking your medication, etc. So even this one spike of 350, 400, whatever, it has been seen to affect your retina. And on other paradigm is the duration of the diabetes. Even though your sugar is always under control throughout your life, if you are, let's say, been a diabetic for more than 15 years, that's where you again start seeing these changes in the retina, small cotton wool spots, or these small hemorrhages. So these are all related to the diabetes only. So as far as your eye and retina issues are something which are very difficult to treat. To be fair to all the retina doctors out there, they do their best. They try to save whatever is left of the patient's vision, but reversing the damage which has been caused is very difficult in the retina. So I always urge my patients to keep your diabetes, and if you are hypertensive also, keep these parameters in check always.
One more question that I had in regards to these surgeries was, sometimes the surgery is required for both the eyes. So can we operate both the eyes? Can we get the operation done for both the eyes at the same time, or do we need to wait for some time before we do that?
So, in our optal practice, it is generally considered unethical or even dangerous to operate both the eyes in the same sitting, because first thing is patients are going to be not very comfortable with this idea, because some doctors prefer to bandage the eye after surgery, or even though they don't, there is a mild state of blurring once the surgery is done initially for the first day. So if you operate both on the same sitting, not only are you inconveniencing the patient with their vision, you're also putting both in jeopardy at the same time, because post-operative complications in one of that is endophthalmitis, which is a very severe complication which can occur in any eye surgery. So you should never take your chances by operating both eyes in the same sitting.
Once the surgery is done, what are all the precautions that we need, especially in today's world where screen time and using the phones are a part of everyone's life? What precautions do you suggest for people post the surgery?
Precaution wise, Dr. Vinici, it's very, like I said before, post an eye surgery, take it any surgery, recovery period is become very fast because of all the lasers that we are using. So personally, I usually I allow my patients to go up and about their business after 2 days of rest. Sometimes the patient himself, they'll be like, no, no, you give us a leave of absence for a week. We want to take rest and all that. So otherwise, I try to let them go back to their day-to-day activities, their work, post their third day, which they are very comfortable with. Using their drops is something which is some patients find it cumbersome, because there's always a set of drops, eye drops, any kind of eye surgery. So, and this goes on for a duration of, let's say, 1 month, or for some doctors prefer it for 2 months also. So this is something a little cumbersome for the patient. So I usually say ki, after the third day, go back to your work, start doing your regular thing. Except that keep your drops with you and try to maintain the duration, or follow the prescription and use the drops on time. In LASIK, we don't recommend ki you go swimming post the surgery at least for 1 month, because any kind of the swimming pool infections are very notorious for eyes. Very difficult to treat also, especially post surgery. So yeah, these are the and another myth when you were talking about this is that patients usually say ki, can we fly after eye surgery? The answer is yes, you very much you can. After the 2 days of rest, from the third day you can definitely fly also.
Right. Dr. Satya Garu, 15,000 surgeries, more than 10 years, 12 years of experience. I'm sure you must have seen so many patients. So if there are 15,000 surgeries, I know the lakhs of people you must have seen and treated. Do you want to tell us any complicated cases that you have seen, and how did you all treat the condition?
Uh, in my experience till now, if you talk about complicated cases, yes, cataract, I have treated quite a few of complicated ones, but the the surgery which I have been trained to and gives me more professional satisfaction is when I do a corneal transplant. I have been trained to do lamellar corneal transplants also, wherein basically the cornea is a structure which has 5 layers. And when you do a lamellar surgery, it is like you are transplanting only the layer which has been affected with that of a donated cornea. A very taxing surgery. If you look at my page, also I have kept a few pictures of these surgeries. Usually, the most satisfaction I get is when these patients are young, and I have tried to give them some vision, and it has worked out. That is what gives me the most satisfaction, because in these younger age groups where the vision demand is so high, they are studying, they want to go about it, and want to be exactly how normal like their peers. So this what motivates me to do these complex, take up these complex surgeries and do my best. And thankfully, so far, patients have had a very good experience. They've come back saying, ki, the vision has improved significantly. So yeah, these are some of the cases, the corneal transplants, which have been challenging for me, have been time taking, and the follow up also, is huge for the page from the patient side. But yeah, so far all have went well. Thank you.
Well, Dr. Garu, when it comes to taking care of eyes, everybody wants to do it, but we do not know what to do. Uh, a lot of us only know about eating carrots, not more than that. So, any general tips that you want to give, to our audiences today about how to take care of your eyes?
The beauty about eyes, Dr. Virinchi, is that we basically take it for granted, but it is such a beautiful structure that it is as delicate as it is resilient. It takes in all the trauma, abuse you give it throughout the day, being whatever, especially your screen time and everything. And eyes are programmed in such a way that even if one eye for any reason is diminished, or the vision potential is low, the other eye tries to compensate, and give you that vision. So basically eyes work in such a way ki, whatever happens, the show must go on. That's what the principle about that they follow, so that we have to give vision to the to the person. And that's how the eyes think, I feel. Whatever happens, the show must go on. They try to compensate each other and give you that perfect vision. So in that scenario, we also have to, because from the morning, from the time you get up till you sleep, and probably, the eyes are what you use the most. So try to give them that rest throughout the day. Nowadays, with this screen time and everything, because eyes were never meant to stare at screens, and screens are what they're just basically bright objects. So you are actually just staring at a bright object throughout, even sometimes without blinking. So one of the things you can do, if possible, is reduce the screen time. If that is not, we understand if it's a part of your work, then at least use this blue filter glasses, or put a blue filter on your screen. Try to take frequent breaks from your screen, like after every half an hour. Just try to, get a move about for a few seconds and then come back and sit. Using of lubricants is also a good practice, because eyes tend to go dry very easily with your screen time. And nowadays, that all the offices are having air conditions, which is just a dry air. Food wise, yes, like you said, carrots, or any food which has the vitamins A, C, and E. These are most beneficial for eye health. They basically give you, it's like a booster shot to the retina of the eye. Many times, patients, when with parents of young children who have got glasses, they come and say, ki, I've been feeding my child carrots and all the vitamins. Still, his power is increasing. So these whatever is there, they either help out the retina, they they enrich the retina, or they have a effect on the tear film. They boost the tear film production. But no food can hamper or change the shape of your eye, which is what is causing this power. So that's something we need to understand. When you get power, it is usually because of the shape of your eye or your cornea. So these foods cannot alter the shape of the eye. So yes, recommended that you take all these vitamins in a good dosage, but that has nothing to do with the power of the eyes.
Well, I think this is a very useful information for me as well as a lot of our audiences, doctor, because we all want to take care of our eyes, but unfortunately, yes, like you said, for some the profession demands them to sit in front of the screen, and at the same time, unfortunately, the extent of electronic media, social media, all of this is making us get glued to the screens. And a lot of times people do complain that I feel a pain in the eye, and they say that I get up in the morning and I suddenly see those blood shed eyes in the morning. And all of these things are inevitable in today's life with the kind of lifestyles that we are having. But I think, yes, taking care of the eye and frequently going to the ophthalmologist is something that we need to bring into our routine, because people want to, like you said, diabetes, hypertension, all of these are actually affecting the eye too. And we are taking care of the diabetes, but we are not seeing how much of an impact it is probably having on the eye. Probably you're taking a medicine for your hypertension, but you don't know what it is doing to your eye. So especially people with these conditions, I think, should be visiting the ophthalmologist more regularly. But otherwise also, eye is a very beautiful organ, like sir said, and I think we should be taking care of it. And with the advent of these newer procedures, we are able to treat them at an early age. So, bringing in treatments at an early age is going to happen only when we start going for regular checkups. And it's a great clinic that we've seen sometime back in the video, True Vision, and a man with a lot of passion, the fourth generation doctor, Dr. Satya Prasad Balki Garu. Thank you so much for giving your time today. Uh, if anybody from the audiences would like to ask questions, sir is available with us for a few more minutes, so we should utilize this time. But otherwise, also this video is going to go live, and there's going to be a lot of people who are going to get in touch with you, doctor. Uh, it's
Happy to.
very you have all those qualities. I mean, you're you talk so well, you're so presentable, and then you have a beautiful clinic. I'm sure it's going to get difficult for all of us to get appointments with you.
No, no, absolutely not. As I said, patient care is something which has been ingrained in me from childhood. I used to go visit my dad's clinic during my summer holidays when I was in school. So I'm most comfortable with my patients around them. So yeah, my doors are always open. Anybody can walk in. Yeah. Another thing, like you said, Dr. Virinchi, is that yeah, usually everybody it is recommended to go in for an eye checkup once a year. But if you are post the age group of 40, I would recommend it at every 6 months, because there are some conditions like, let's say I talk about glaucoma. It is a silent assassin. You will not know that you have glaucoma in most conditions till it's at an end stage wherein your vision is severely hampered. So at least every 6 months post the age of 40, if you can just go in for your eye checkup, and if there is anything which indicates a glaucoma, or you progressing towards it's always better to diagnose it early, which your doctor would do. And if you are hypertensive or diabetic, again 6 months checkup is very much mandated. Any systemic conditions, be it thyroid or autoimmune diseases like rheumatoid arthritis, some patients with tuberculosis, cancer conditions, they all should get their eyes checked periodically.
think this is again a very useful information that you've given us, doctor. So I think this is a take home for all the audiences. Uh, when if you are having any underlying health condition like diabetes, rheumatoid arthritis, or hypertension, or if there is somebody in the family, even if these values are under control, even if the diabetes or hypertension is under control, it is important that you visit your ophthalmologist once in 6 months. And we all know there is Dr. Satya Prasad Garu with a lot of experience, more than 12 years of work, 15,000 surgeries, lakhs of patients, and he's come up with a new setup in Khajaguda, the True Vision. So make sure that this appointment is happening as an important aspect, for you or your loved ones. There's a lot of appreciation coming in the audiences, sir. I think it's been a treat for us. It's you've given us our Sunday's healthy dose today. Once again, we thank you so much. If Since there are no questions from the audiences, I think we should let Sir get back to his routine. It's a Sunday, so we're not going to take more time from you. But thank you so much, sir, once again for coming up to us today and removing your valuable time for us and helping us understand about what these surgeries are, how safe these surgeries are, how well advanced we in India are with in regards to these surgeries, and how important it is to regularly take care of our eyes. And especially when we have any underlying health related issue, we need to understand that, like Dr. Garu said, it is even affecting your eye. And some conditions like glaucoma are silent, so regular follow-ups with the doctor is something that can help us, protect and save our eyes. Thank you, sir. Thank you so much. And uh, we would again like to disturb you at some point to come back with a new topic and enlighten all of us, doctor.
Definitely. This was a great talk, I think, Dr. Virenchi. A lot of positivity and good vibes here. And it's been an honor to be on Healthy Dose. It was a good Sunday well spent, I would say. I hope the same for our audience also.
Absolutely, sir. Absolutely. Thank you. Thank you so much,
Thank
Dr.
you,
Garu.
Lord. Thank you, Dr. Virenchi. Thank
Thank
you.
you. Namaskar.